Joining us now to talk about Medicare for All and Bernie Sanders' most recent plan that would make it a reality is Deborah Berger, president of National Nurses United. Deborah, welcome to the Damage Report.
Good morning. It's good to be on. Thank you.
We're very glad to have you here. So before we jump into Medicare for All, can you, for people who might not be familiar, can you talk a little bit about National Nurses United and how it works?
National Nurses United is the largest professional nurses association and the largest all-registered nurses union in the country. And we have had a progressive agenda of working for social justice, climate justice, economic justice, and healthcare justice for decades.
And so, from the point of view of National Nurses United, from a nurse's point of view, why is Medicare for All something that you're interested in?
Medicare for All is something that we've been interested in for decades because we're at the bedside. We're at the front line where we see patients harmed because they don't have access to insurance and health care. They often are having to make immoral choices on whether they pay the rent or get their chemotherapy. And we believe that healthcare is a human right, and we really need to move that issue forward. And it's moving.
It certainly does seem to. I mean, when you look at polls of Medicare for All or alternative plans like that, it's very popular. There are also, of course, multiple different ways that you could get to Medicare for All or some other form of single-payer health care. Bernie Sanders' plans, which he's updated recently, what do you make of those?
His is the gold standard. We've worked with him for decades to make Medicare for All an issue. He put it as front and center in his presidential campaign, and we joked with him by saying that he actually adopted our agenda for healthcare for all. So we're really excited that he's submitted the bill again this year.
So you've got on the one side, you've got National Nurses United, some politicians pushing for Medicare for All, which is becoming increasingly popular. You do have pushback from the other side, though. I saw yesterday the CEO of, I believe it was UnitedHealth, saying that Medicare for All would destabilize healthcare in the U.S. I imagine nurses would know if that was the case. So are you concerned that it might destabilize healthcare?
What it's really going to do is destabilize the insurance industry's profits. It's not going to destabilize healthcare at all. In fact, it's going to make it better and more accessible for every single American in the United States.
So from the point of view of your organization, what are some of the main issues, the systemic or personal issues with healthcare access and health insurance that you think need to be addressed most urgently?
Most urgently is the fact that Americans are paying for health care, insurance, but they don't actually have access to real health care. They have copays and deductibles and premiums that prevent them from actually using the health care insurance that they're paying for. And we know that this bill, along with the bill by Pramila Jayapal, will actually address those issues.
Thank you very much for watching this clip from the Damage Report. If you liked it, don't forget to subscribe to this channel and ring the bell on YouTube to get notifications of our new videos. And of course, you can catch the full Damage Report live every weekday at 1 p.m. Eastern, 10 a.m. Pacific on TYT Network on YouTube TV.